All right, we're going to get started here if people can find a seat. All right, we're going to get started. Please find your seat. Right. Great. Welcome, everyone, to this morning's legislative update. Can everybody hear me okay? All right, thank you. My name is Jessica McDonald, and I'm with the League of Women Voters, and I get to be your moderator for this morning. This is our second to last legislative update of this session. Our next and final one is on June 7th, same time, same place. Hope to see you here. So there's a captive audience. Let me take a moment to orient you to the League of Women Voters. We are a nonpartisan grassroots organization working to protect and expand voting rights and ensure everyone is represented in our democracy. The League of Women Voters of Corvallis encourages informed and active participation in government. And this includes issues that matter most to you, things like affordable housing and climate change and community development. We do not endorse or oppose political parties or candidates, but we are political. Leagues and its membership at the local, at the state, at the national level, we are not a monolith. We represent opinions and positions that can be found across the American political spectrum. What brings us together is our commitment to voter empowerment and defending democracy. So standing up for these values is not a partisan narrative, but really is a pathway towards inclusion. So I encourage you to get involved in the League if you don't already. There's a lot of people here that already know quite a bit about the League, but for those that don't, I encourage you to get involved. I want to throw a couple of websites at you. Local League, lwvcorvallis.org, the state level, lwvor.org, and at the national level, lwv.org. The last League item I want to mention is if you're interested in learning more, we happen to have a great opportunity to get involved and get a retrospective of the last year, get a little dinner, hear from a keynote speaker at our annual meeting coming up on May 28th at 6 p.m. at the Corvallis Library in the main meeting room. This is a registration event because of the dinner. And we also have League members that will be voting on actions like board membership. We have a keynote speaker, Robin De La Mora, founder and CEO of Collaborative Employment Innovation. So I would love to see you there. Special thanks to Benton County for co-sponsoring this legislative update. I also wanted to note that there are a couple of handouts at the back, and there may be more that have come in since we grabbed these. There's one on the task force for the Coffin Butte landfill. And then we also have a list here of local nonprofits that have had reduced or eliminated federal funding in the last couple of months who you might consider supporting. So now on to our program. This morning, we are happy to have some of our state legislators with representation here in Benton County. And just to clarify, We invite all legislators who have representation that touches a portion of Benton County. However, people have lives and there's things going on in Salem and all kinds of reasons that people can't be here. I think uh, David Gomberg just had to go to a parade, as I heard, from the breakfast that came right before this one. So today we are happy to have Senator Sarah Gelser Bluen with District 8 and Representative Sarah Finger McDonald, District 16. Each legislator will take about 15 minutes to give you an overview of what is going on in the Capitol from their perspective. And then we're going to open the floor to your questions. So if you want to write a question, Janet over here, a volunteer, has some cards and pens. And just hold your hand up at any time that a question strikes you, and she'll both give you a card as well as come and pick them up afterwards to bring up here. We'll also take oral questions and have people come up to the microphone. And if we get some online people, we can also rotate online questions as well. A reminder, please ask a concise question rather than a statement. I think we've all been there, and let's not have that be us. We will end the update promptly at 11:45. And now I want to turn it over to our elected officials to give us an overview of the hot topics and what's going on in Salem. So I'll let you choose who goes first here.
Apparently I'm brave because I'm going first. But yeah, so we do have a list of, and this is not an exhaustive list of organizations in our community that play important roles that may have lost funding already or are worried that they will lose funding. And last town hall that we had, I think both the senator and I talked a lot about, is people ask us what they can do during these very uncertain times. One important thing we can do is act like a community and support those in our community who are under attack, who play the important roles of supporting, whether it's the arts or social services or schools, who play those roles in our community and supporting them. I know with the pandemic, we've seen kind of a decrease in volunteerism and supportive community organizations, just I think as we sort of lost that habit because we were all so isolated. And if this is the time to really step up and get back in that habit of supporting our community and organizations in our community. So there is a list. It is not exhaustive. If you have organizations that you support, you please keep supporting them. And it's just going to be more and more a key part of what we can do to help each other. So, so that's this list that's back there. The other piece of paper that's back there is the information about the Coffin Butte landfill task force. That is a bill that I have that's now in Ways and Means because it requires staffing and funding to have a task force. There's something like 48 task force in Ways and Means. So if this is one that's important to you, and I think it's really important to our community, it's really important to the whole northwest corner of Oregon that uses the landfill in our district. So if you want to support the effort to start planning now for what we will do as Coffin Butte comes to the end of its life, there's information about who you can contact to express your support for that bill, because right now that's where we are. We're waiting to get funding with Ways and Means. And that process is, there are lots of things sitting in Ways and Means right now. The funding for Dare Village's wastewater treatment plant is in Ways and Means right now. And those bills will wait, and then we'll sit there while we wait for our economic forecast, which will come out on the 14th. And then we start the budgeting process and prioritizing what we're going to spend our money on. So it's important that if you have things that you want to have funded, that you let people know. So those are sort of the Adair Village and Coffin Butte were sort of my two big, I want to, as a new legislator, really want to focus on some local issues. So those were kind of my two big priorities, and now they're waiting. So I don't have a big update on those right now. But there are some other bills that I want to talk about positive things right now. There's some other bills that are moving along this session that I think are really important to think about, because they're things that are helping us make life better for Oregonians. And one that I'm really excited about that was signed by the governor this week is the funding for summer learning programs. We've been really lucky in the Corvallis School District to have strong support from our Public Schools Foundation that's allowed us to have summer programming and to plan for that summer programming. But that bill will give that opportunity to school districts across the state and will allow us to strengthen our program. And it's really important for literacy and for credit recovery, for allowing students to graduate on time. So I think that's a real win for our students. There's an interesting bill that's a consumer protections bill that's passed out of the House and is now on the Senate side, that's looking at data and protections for our data. And so it's really focused on protecting the data of children under 16, that we can't just sell that and trade that around, and protect the precise location so that within, now I don't remember the number, a certain distance, you can't precisely locate somebody and share that data. So it means that those data companies can't tell where you go after work, or if you've visited a medical clinic that you might not want people to know that you're going to. So I think that's an important bill for protecting Oregonians. One bill that somebody approached me with early on in this process for me was employment discrimination by age. And when they asked me about it, I laughed and I said, I'm a 52-year-old woman. This means a lot to me because I have seen a lot of my friends, especially as our kids get older, even if we've been working, as we've been raising kids, we're kind of at this point where because parenting's taking less time, we're looking at changing careers or advancing in our career, and that issue of age becomes a problem. So protecting people from being discriminated against as they apply for jobs based on their age is important for a lot of people. I think it's especially important for people who've been sort of the primary caregivers in their family, which often is women. We have the Fair Energy Act that will make it so that consumers are not carrying the cost burden of our large energy users as we increase data centers and chip manufacturers in the state who just are going to be using a lot of energy. And we want to put that burden of that increased cost on them rather than on individual consumers. We've addressed strengthening the Oregon Health Plan so that if, assuming that Medicare changes don't happen, which is a big worry, but Oregon's done a great job of really leveraging the money that's been available to support as many Oregonians as we can. And so we've made sure that that is still in place. Maybe that all that kind of gets blown up, but for right now, we've done what we can do to maintain that strong focus on the Oregon Health Plan. I'm trying to focus a little bit. I think on the more worrying side of what I've been thinking about, we're waiting for our budget forecast. There's been a lot of uncertainty created in our economy. And as a export state, how tariffs are going to affect us is sort of this big unknown. How the federal budget is going to affect us, I'm worried with the outline that came out this week, because we have lots of people in our community who are working in education and working for the EPA and NOAA, and a lot of the agencies that are really being, if that outline really becomes what the budget looks like, can really be hit. I'm worried about how that's going to affect jobs in our community, and the ability to do the work that our community really values around education and research and innovation. So we're waiting to see how that all falls out. And And you've been talking, I was engaged with OSU, with the Office of Diversity, when we had students who were losing their visas. And so I've been actively, engaging with our university here, trying to make sure that we're doing what we can to make sure that those students had representation and support. Um, one of my really good friends had a graduate student who was in that group of 13 students. And so you just the stress that put on that student specifically, but then everyone who was trying to support him was really hard. And the sort of downstream effects of all that is I think it's going to affect our ability to really attract those great minds that we want here, learning and doing the really valuable work that we you do in our district. One of the things with the federal budget too, Senator Gelster-Bluin and I were just talking about this at the breakfast. There's so much uncertainty that's been created by all the effects of the federal government because there's no funding, there is funding, the money is not there, the money's there. And KidCo Head Start this week, their students had been out for a month because the funding had disappeared. They were supposed to get the funding back and they were expecting to open, but then the money wasn't available. And then I guess Thursday night, the money became available. And so they were ready to reopen. But all of this is just creating a lot of stress and uncertainty in our community. I mean, that was not just the employees at that center who didn't know if they were going to work. It was the kids who that was, where they had friends and their socialization. And it was all those parents who were worried about whether they would be able to go to work because they didn't have anywhere to send their kids. And it affects our state budget too, because some of the programs that they weren't going to be able to offer because they couldn't get the federal money were actually things that were funded also by state money. So there were things that we had invested in Oregonians that because of decisions made on the federal level, those programs weren't going to be able to go forward. So luckily that's resolved, but that uncertainty is still there. I continue to talk a lot about scientific research and how that's not something we can just flip a switch when funding comes back to continue. As somebody with a background in science and somebody who's benefited from advances in biomedical science, I will continue talking about the importance of that. It's the research, it's the science, it's the innovation, it's the being able to train graduate students who are going to be the next in line and undergraduates to give them the opportunity. So I feel like I talk about that a lot. And then the committees that I'm on. So I'm on higher ed and I'm on ag, natural resources, land use and water, or ag and everything else. And in higher ed, I continue to tell my committee chair and vice chairs that my priorities are that we support higher ed, that we keep higher ed accessible to our students. Not just because we have one of the major universities in the state in our district, but because that's our workforce, that's opportunities for students. Access to higher ed can change the trajectory of not just the student involved, but their whole family's lives. And so we really need to make sure that even with all of the concern about funding, that we make sure that we do everything we can to keep higher ed and workforce training available to all Oregonians. In ag and natural resources, I have learned so much about water policy this session. I'm on that committee because of my background in horticulture, but there are all these, that is a very broad list of topics that committee covers. And this week got really into the weeds talking about salmon hatch boxes and was pulling out my, biology undergrad ecology knowledge to think about how all these fry that could potentially be released into rivers would affect populations of things like smallmouth bass, that we don't want that population to boom, but if we feed them a bunch of fry, what will happen? So that's been fun to learn. I feel like that's the committee that I've learned the most in this session. Um, it's also the committee that I'm worried about because that's where, as we worry about budget things and we prioritize taking care of people, the reality is that where we're going to see cuts and where we're going to put less priority is on things like protecting our natural resources, is on things like addressing issues that could affect um, climate resiliency. And again, those are things that we can't just switch the switch on when the funding's back and bring back. And so even if we can protect people, I worry about sort of the long-term effects on the world we're creating for our kids. And so that's been a real challenge. So I started out happy, but now I'm gonna be a downer. So I will end on that. This one is open.
Okay. Oh, I think this one's not plugged in. That's one.
Um,
That would do it. Hi. Thank you all so much for coming this morning. Again, my name is also Sarah, Sarah with no H, Sarah with an H. How's Sarah? Send it Sarah. And laughing in the back is my son, Sam. Sam, do you want to wave? Thanks for coming, Sam. Uh, Most important job I ever had. It's been a while since Sam's come. And last week, Sam, what's better, Sam? Town hall or a marathon? Town hall? Yeah. Sam, can I say what you said about the marathon? So my daughter came back from Washington DC last week. She works for Congresswoman Hoyle on Capitol Hill, but she ran an Eugene Marathon. And it was early and it was cold and she had taken off and Sam and I were walking up the ramp to Hayward Field and Sam said, I just don't like marathons. I really don't like duck marathons. If it was a beaver marathon, that would be okay, but I just really don't like duck marathons. And I was like, why? And he's like, I just don't like ducks. So I asked you, do you dislike all ducks? And you said, no, you like Donald Duck and ducks in ponds, but not Eugene ducks. So Sam has clearly grown up in Corvallis, and that is why I'm very proud to represent Beaver Nation. So good morning and thank you all for coming today. I know the sun is starting to come out and the flowers are starting to bloom. This seems to be an extra good year for Columbine. If you're looking around for some reason, I don't know why, it's just everywhere. The Columbine is amazing. So we are officially about 6 weeks from what we call Target Sine Die. So there's Constitutional Sine Die on June 29th. June 29th at 11:59 p.m. and 59 seconds. No matter what's happening, we have to be done. Our goal is to be done by 18th, the 18th. So that's 6 weeks out. And within that 6 weeks, we have a bunch of things that we need to do. And so we're kind of at the point where we've come through all of the race of the start of the session and the first chamber deadline. Then we had a little bit of a lull for a week and a half, 2 weeks, where we spent a lot of time on the floor just voting on things that had already been voted on. These are the more we had a handful of controversial things, but now things are picking back up again. And we start to get into the more controversial and challenging things. Obviously, the biggest thing is the budget. We have to balance the budget, which I'll talk about a little bit more in a minute. Other things that are just sitting, hanging out, waiting for us to deal with include things like labor issues, guns, transportation plan, land use, primates, firearms, civil commitment, healthcare, and some of the really challenging issues I think in healthcare is that the impact of corporate medicine really on our hospital systems is changing the way I'm thinking about some of the bills that I would have really quickly voted for in the past, just because our hospital systems are at such a tenuous place compared to where they were just a few years ago. So many of those things are currently sitting in a committee called Rules. Rules is where things go when they're not quite ready. I think this session we have a record number of bills, not just that got sent to Rules, but that got sent to rules without any recommendation. So usually a bill will go to rules, a majority of the committee will agree on some form of it, but know that they're just not quite there yet. There's still some things that need to be worked out, and it will go to the Committee on Rules with recommendation to be passed. When something goes to rules without any recommendation, it means the committee's like, this thing is not ready. We don't know what's going to make it ready. And for whatever reason, we can't kill it. We don't want to say no, or it's important to somebody. And so they all go down to rules. And there's always a couple of those. But what's challenging this time is they're really, really big, very controversial things that are divisive, not just like traditionally along party lines or geographic lines, but you've got folks kind of all over the place on them. So that is going to be really, really interesting to see how that all plays off. Our transportation package is something that you'll start hearing a lot more about. And that is a really hard vote for folks to take. It requires a supermajority. So that is 18 votes in the Senate and 36 votes in the House. And one could say, good thing you have 18 Democrats that are likely to vote for it in the Senate and 36 Democrats that are likely to vote for it in the House. The problem is that one of our 18 Democrats passed away 2 weeks ago. So his seat is now vacant. And it appears that his seat, which will be filled, will likely be filled by someone from the House chamber. So we'll get back up to 18, but they'll go down to 35. And they have another member who, for health reasons, has been out almost all session, and it's unclear whether that member is going to be able to come back this session. So there is a lot of pressure, as there always should be, to really work on something that can get a bipartisan vote to come to the floor. I think you'll start hearing more about this. I know there was a proposal that was unveiled last week by some members of the Republican caucus that focused mostly on reductions within ODOT. The problem with that, from my perspective, is that it doesn't give us what we need in terms of investment in maintenance in our roads and our bridges and our rail all across the state. And I think I mentioned this last month, but right now, the way that we fund our transportation infrastructure, our bridges in the state are on a 900-year replacement cycle. So you can't just do that within our normal operating budget. We have to prioritize those things to get them up and running. And you can see that. I mean, it's actually been really interesting after all of these years talking about the Van Buren Bridge in a variety of ways. I live in this part of town, so I go out over Van Buren Bridge when I head up to Salem, and just watching the progress on a day-to-day basis, it's really interesting. And it's a lot of work and it's very expensive. And so obviously we're not doing a bridge every year. And that came out of the transportation package we did almost 10 years ago. The other thing that came out of the transportation package that we did almost 10 years ago are the improvements that you've seen go into place on Highway 20 between Corvallis and Albany. That was a priority project for me. I love driving that way now. People were very unhappy with it during the construction, but now as you get to Granger and Independence, it is a lot more safe. We have a lot fewer crashes. I actually had a crash there. After I had started advocating for it. So I told the Senate president I was just really diving into lobbying for my bill. So those are the types of things that we need to do. And when you're looking at the transportation package and listening to people thinking about the transportation package, I know that there are a lot of people that, for a whole variety of reasons, all across the spectrum, get frustrated with ODOT. And ODOT, for better or worse, has had a spotty record of success. There have been some accountability issues, but that is not the transportation package. The transportation package is about investment in the long-term maintenance of the infrastructure that allows us to get to where we need to go, that ensures that ambulances and fire trucks can get to us when we need them, that ensures freight can get moved across the state, that we can go and see our friends and neighbors, and that the bridge doesn't fall down while we're driving across it to go to work. The place where we are really looking at and hearing the issues around transparency are within the budget process. So there is an ODOT budget, and I'm told by our co-chair that there will be some significant changes within ODOT as a part of that budget. But again, that is not the transportation plan. The transportation plan is like taking care of the roof on our house. It doesn't feel very good when you have to make the big investment in it. It always hurts to write that check, but it's a lot. You're glad you did it in the winter when your roof is not leaking and you're not having to pay for water damage as well. So that is coming up. If you've got questions about it, concerns about it, please reach out. We're just starting to get a lot more information. There was a framework that was put out about a month ago, a little bit more than a month ago, from the Joint Transportation Committee, but I think we'll be getting more information as things move forward. One of the bills that I'm working on, one of my priority bills this session, is another element of the Coffin Butte discussion, and that is around how do we accurately measure methane leaks from solid waste municipal landfills. And so it's a really simple bill that just directs the Department of Environmental Quality to adopt rules that require the larger landfill operators to use advanced technology to ensure that they are getting the most complete reading of methane emissions on their landfill and the most accurate. Right now, and I think I mentioned this last month too, but it's a manual process where, and I think about this as my grandpa, every time I talk about it, I think of my grandpa. Actually, I think today is the 1-year anniversary of his passing, but he had a metal detector, and it was always fun to go with grandpa and go to the beach, go to a park, and you walk along in a grid and you find the treasures. That's kind of what happens on the landfill. There's some guy like my grandpa walking along with a wand in a grid looking for methane leaks. And he can't get to the whole landfill because there's parts of it that are just not safe. That's a pretty significant percentage of the landfill. So we need more of that information. In the long run, it'll be more cost effective. And that's what this bill will do. It will also make sure that the data, it doesn't change what data people are required to collect. It's just the format that it is released in. And it actually makes it less work for the data to be released. It just allows us to use the raw data a little bit better. So it passed through the Senate. It had a hearing in the House on, was that Thursday? Yeah, that was Thursday. And on Thursday, they didn't get through all the public testimony. I talked to Chair Lively yesterday. It's rescheduled to hear the rest of the public testimony, but I'm feeling very hopeful that that bill will be on the House floor soon. And I'm really grateful to have Representative Finger McDonald as a co-chief sponsor of that measure. Another bill that's been a big priority for me this session is now down in Ways and Means, is related to long-term care safety in nursing homes and assisted living facilities. I'm really pleased with where we landed with this bill. It's always very difficult to get all of the stakeholders together and come up with something that is meaningful and that you can have nobody oppose. This one does that in that it will improve the, it will ensure that there are more timely inspections of new memory care and assisted living facilities. So an inspector will actually go out within 120 days of the time the first resident moves in. Right now, it's often 2 years after the first person goes in. And for all the reasons you can imagine, that is not ideal. It will ensure that if there's a death or a serious physical injury that might be due to a violation of the license regulations, that the department will go out and start their investigation within 24 hours or by the end of the next business day. And what's really exciting about it is that it will require the department to do 2 things and the facility to do 1. The department first will create just a 1-page document that explains to people how to access online the licensing history of every long-term care facility in the state. And whenever you go shopping for a place for yourself or a loved one, and you're starting to talk about admission, the facility is required to give that to you. So you can go and look up the licensing history, any citations of that place. The second thing that's required is that when there is a licensing violation that is founded or substantiated, the department, in addition to their complicated report, has to put together a plain language report to provide to the facility. And in cases where the finding, the substantiated finding, is one of a pattern or a persistent ongoing issue that creates a risk to others, or if it was there's a restriction of admissions is put on, or there was a death or serious injury and there's an ongoing threat to others and a restriction on admissions is put into place, anyone that wants to come live in the facility has to be told that, and each individual will be notified, as well as one person outside the facility that they have designated as their contact person. They will also be directly contacted if they're put into something that's called this enhanced oversight program. This is a really big deal. That is a lot of information that people need. In exchange for that, what made it palatable to the Oregon Healthcare Association that represents the nursing homes and long-term care facilities, and they were such great partners in negotiating this. Right now, they'll have a licensing investigation, and there's just a really long delay in getting the final report to know what happened. So it ensures that that is timely, that from the start to the end, it's 90 days. And when they do have a violation and it's posted up on the website, when they come into compliance and they tell the agency needs to immediately review that. And once they agree that it's remediated, within 5 days, they need to get it off the website. And that to me makes sense. That's not fair to have a deficiency on your website when you've already fixed the problem. So this is now sitting in Ways and Means. I've marked this, kind of coming out of my policy committee as the #1 budgeting priority, because it does require some additional positions at the department. The good news is that I took the department's bill that had positions in it to do some of these things and pulled it into this bill. So there are only a handful of additional positions. So we will get a whole lot for a small amount of general fund that is not already in the governor's budget. And that's the only reason that I have hope that this bill will move forward. One of the other things I'm working on is Osborne Aquatic Center. It's the most fun thing I've worked on in a really long time, because it turns out everybody loves Osborne Aquatic Center. And people are sending their logos. We get to make our pitch on Friday. I think we're up to, we started getting logos yesterday morning. I think we're up to 25 or 26. We have every single swim club in the state that's youth. Now they're moving on to the master swims clubs. We've got the national blind swimmers. We've got universities and colleges all up and down the coast, the Special Olympics. It's really exciting to see what a resource this is. And it's just really fun. And so if you want to be part of a letter writing campaign, just let us know. So we'll have the hearing on Friday, but we will continue to have folks advocating. And the great thing is that because literally people in every community in the state use our pool, we have people that can go out and talk to every single legislator about how it impacts people in their districts. So I'm very hopeful. It's an ask for $4 million in lottery bonds with a $1 million additional if we can rate that additional $1 million in private contributions. And then the rest would be up to the city and the school district to figure out. So probably a bond levy, we will figure out what that is. Okay, I feel like there was one other thing I wanted to mention here. Roads, highways, bridges, guns, tariffs. Oh, budget. Yeah, budget. Budgets are hard and uncertain. The revenue forecast is on May 14th. And so when we pass the bills out of committees that have budget asks attached to them, they go down to the Ways and Means Committee and they sit there until they're released. And we really don't know what they are until they're released, even the co-chairs. This year, the process has changed a little bit. I've been there for 20 years, and this is the first time that I can recall the policy committee chairs being asked to force rank everything that came out of their committee that costs money. So everything had to go in an order. And as I looked at all the criteria, there were some things that I said, these are really great ideas and I wish we could do them, but this is not the time. So I took those off the list. Recommended as a policy, don't recommend it as a budget priority. And it really creates that opportunity to connect policy with budget, which is really important when you're looking at reductions. So just expect to hear more about all of those things as we move forward. And then a question that I'll be asking for people to let me know what you think about in my committee is the ban cell phones in schools bill from opening bell to ending bell. I have concerns about the bill for a number of reasons: safety, local control, but mostly because it deletes some language that we worked really hard to put in 2013 that talked about the idea of independent communication. So for people with disabilities that can't verbally communicate or who might be blind or deaf, using the device that's in your pocket is cheaper and more accessible and more effective than a piece of assistive technology. And what we had put into the statute, because kids were having a hard time being allowed to use that at school, was that a kid that used that to communicate with independent communications couldn't be prohibited from doing that or using their own device, because it doesn't really work to jump across devices. So that is a piece that I will want to make sure gets addressed if it moves forward. But I'm just curious to know and hear from others what your thoughts are. about that bill. It's another one of those really interesting ones that is not breaking down on geographic or party lines. It's just really good lunchtime conversation. And I want to make sure that I'm representing what y'all are thinking. So thank you.
Great. Thank you so much. That was a great overview, and we have some questions that are already getting compiled. And please, if you wanted to write one down, just to flag, and Janet will get you a note card. One really quick piece of follow-up on Osborne. There was already a question, so I'm glad you got to that. But could you, people always want to know the bill numbers so that they can go into OLIS and maybe provide testimony or do whatever they can to support or oppose something. So there's a question about what the bill number is, and you already talked about a letter writing campaign, but the question was, how can the community show support for this?
Thank you. Excellent question. And one that I myself asked earlier this week. It's the first time that I have asked for lottery bonds. So it's not a bill in and of itself. There is a big bill that comes at the end of session. It's one of the Christmas tree bills. That's the lottery bond bill. I do not off the top of my head know the bill number, but I'm going to send it out to the world in general. And what I've noticed is anytime I say something about this, like every email list I'm on in the community, I get the information back. So I trust if you are on any social media or email list, you will see the bill number. But it is that lottery fund budget, and you would put that written information in there. We are working on kind of making a QR code that will just quickly identify the email addresses that it is helpful for you to write to with the information that is helpful to put in. And we're going to have that inside or just over near Osborne Aquatic Center. So you should be able to point your phone at it and do it there. And then you can do it from online. But this is the request that I have. And this was my condition when I agreed to that. It's not as helpful if you just hit the QR code and hit send. What is helpful is if you click the QR code, look at the information, and in a paragraph or 2 paragraphs, explain why it's important to you in your own words. And this one is really important for that because everyone has a different reason. And the only reason that I think that this has a shot in the lottery bond process is it is not just a Corvallis community priority. This pool serves the entire state and the region. It's one of the top 3 pools on the entire West Coast because of the size of its observation deck. And so what we're really trying to focus on is that regional benefit that we're going to step up as a community. We're going to carry the load of most of the cost, but we do need some help in these times to kind of get that over the finish line.
Thank you. If anybody has a question and wants to come up here, I'll get you in the queue to ask in person. Otherwise, I'll move on to another written question here. So maybe Senator Gelser-Balloon, you could also speak to this one because I saw that you're a chief co-sponsor on House Bill 3212 on pharmacy benefits. And somebody is saying, just can you speak to it and the fact that independent pharmacies are encouraging support?
Thank you. And I think you're co-sponsor too. Are you
I
on
think
that
I'm
one?
a co-sponsor.
So we had a similar bill to this in the 2023 session, and we had what's now a relatively famous day on the Senate floor on the last day of session where there were many, many feelings. And sometimes when there's a lot of feelings on the floor of a House or a Senate, a lot of things just start to die. And our PBM bill was one of those during that session 2 years ago. So we brought it back. And this is the thing so pharmacy benefit managers are like the middleman in drug prices. And many of you in the room have written to me about this, so I'm not going to go into great detail. I will tell you the mystery to me, even the Trump administration doesn't like pharmacy benefit managers. I cannot find anybody that likes pharmacy benefit managers. Nobody will say they like pharmacy benefit managers. And yet it is the most difficult thing to change. And I don't completely understand how or why, because really the PBM has no friends, but it is the strongest loner I've ever seen. So in the committee, there was some push and confusion right at the end and a request for an amendment. And there was concern that amendment, there was dispute about whether the amendment would weaken the bill or not weaken the bill. So the bill went to rules. My hope is that it will come out of rules and that it will remain unamended. And I'm not completely in the loop. Representative Nathanson is kind of the lead on shepherding this. She is the ultimate champion of PBM reform in the legislature. But I do know Rice's Pharmacy has been doing an incredible job. Hello. I actually have a file that says PBM letters referencing Rice's Pharmacy. There are a lot of them. So well done. And I heard today at the local government breakfast that there's a sign. So I was going to come over today and take a picture of the sign. But personalize it, as many people have been. Click the QR code, then personalize why you love Rice's Pharmacy and why we need to pass the bill to keep Rice's open. And I will just say, Rice's is a really great example of why independent pharmacies are incredibly important. You can get medications there that you don't always have access to. You have pharmacists there that really understand you and know what you need. During the pandemic, if it was not for Rice's, we would not have been able to get vaccinations out to our long-term care facilities, some of our folks with disabilities. Rice's is just always there and stepping up. I can also reference there's an independent pharmacy, a little tiny one in Lebanon. And we needed a drug that the manufacturers, there was a stoppage on it. So there wasn't any place. And there was like one bottle at this little independent pharmacy in Lebanon. And we need these. We absolutely need these. It's not just about getting the medications. These are incredible community partners that kind of hold our communities together. So thanks for helping to educate people about that. And we'll do the very best that we can to get that done. Yes.
I know you guys.
Hopefully it comes out. If you send me an email today, I will get you that list of the Rules Committee folks and others that might be helpful to connect with. Thank you. Thanks.
All right, thank you.
The pharmacist on this bill, so.
All right, in person, and just watch out for this little ramp here.
Thank you for your time today. I know there's a lot of budget uncertainty federally, and also Oregon has underfunded K-12 education for decades. As a parent at a Title I school, we live the negative impacts of that underfunding daily. I want to know what each of you are planning to do this session to move us towards a future where K-12 is sufficiently funded in the state. Thank you.
Do you want to start? Sure. I am familiar with this issue, having been on the school board for 7 years and having children who went to one of our Title I schools in Corvallis. And I'm not on the K-12 committee. I'm not on Ways and Means, but in conversations with my colleagues who are, and with my colleagues in a broader manner, I have spoken a lot about the need for funding and the fact that we talk about school funding, people talk about, oh, we just invested record amounts, but I also think we lose the fact that schools provide a lot of services that aren't just reading, writing, and arithmetic. And as we've cut social services other places, schools are really doing a lot to support our kids and families, and we need to recognize that. So in my role, because I'm not on those committees, it's just something I talk about. I talk about the impact on schools. I've sponsored the investment in summer learning. I've sponsored the bill to either remove or reduce the cap on funding for students with special needs in education. So I'm being an advocate as much as I can in those conversations. And I would tell you that we haven't just, it's not just a K-12 issue, it's a higher ed issue too, that we really need to think about how we support our students all the way through.
So the first budget that we generally pass is the K-12 budget, and we don't really land on where that number is until we get to this May revenue forecast on May 14th. So on May 14th, the state revenue officer will get out his crystal ball and will anticipate how much revenue will come into the state in the next 2 years. And that number is really important because at the state level, we can't spend a penny more than what we bring in. So that is when we get the definition of what is the size of the pie. What's different this year is that we don't really know that that's the final answer because there's just so much instability. If you look at unemployment, if you look at the federal money that's coming in, the decreases in investment in research and higher ed at the federal level, we are an income-based state. We don't have a sales tax, and our property tax is relatively limited, which I'll get to in a second. But that means any of these fluctuations that impact income are going to impact our state general fund, what we're bringing in. And then you add on top of who knows what is coming or not coming from the federal government and what strings will be attached. So I share that part to just to kind of level set the expectation. I think all programs and services across the state, we're going to be making really hard choices and knowing that we're not getting everything done that we need to get done. We have set up K-12 at the start of the session with a different way of forecasting what the current service level is. So just right out of the gate, where we look at the goal of at least maintaining everything at current service level, that actually is a leap in actual dollars for K-12 beyond what it would have been before. So that's the first part. The second part, the lifting of the cap on the special ed funds comes with an additional investment, because unless you put more money into the fund, the lifting the cap doesn't make a whole lot of a difference. And I think I mentioned this last month, state school fund is a very complicated and old process that I don't think serves our state very well anymore. And other states have better ways of funding special education to get the resources where they need to be, and looking at poverty and some of these other things as well. So I'm really interested in that as well. How do we run those funds, and does the funding formula really get things to where it is that they need to go? And then we're also looking at some efficiencies for districts. Are there things that we're asking districts to do that we don't need to ask them to do anymore to free up some more time and space? At the end of the day, one of the reasons that we've been underfunded for decades is that we just removed an entire revenue stream with the passage of Measure 5 and then 47 and 50. We capped everybody's property taxes at exactly where they were, kind of put a cap on how much they could increase each year. And then all of that goes to the big state school fund in the sky and gets divided out. The problem is that we've got winners and losers in the state. Everybody was frozen at where they were at that time. And so a community like ours that had historically invested in public education, our taxpayers keep paying those tax rates that are pretty close to the $5 per thousand limit. You've got other parts of the state that are at $1 per thousand. So there's theoretically a lot more capacity across the state under that $5 limit, but figuring out how you get to that to be able to unleash that money to public schools, I don't know. And until we get to that, it is going to be very difficult to right size that, because if you're looking at your senior services and child welfare services and roads and bridges and medical care, Medicaid, firefighting, wildfire, huge cost, public defense, another place, historic investment, we're nowhere close to where we need to be to meet our constitutional obligations. It's going to require revenue reform. And I will continue to be willing to take those votes.
Thank you. All right, we have a question on gender affirming care. Please explain the law passed for gender affirming care in Oregon, and how does it affect our schools? I think there's a note saying maybe bill number 2020.
I can talk about that. I'm like suddenly really hot.
It's warm
Yeah.
out here.
So I'm gonna I'm gonna take off my jacket. Sometimes lately it is just me, but I know it's like we're just always hot. Sorry. Just had to rewind in time for a second. So I sat on the Ways and Means Committee 2 years ago in 2023 when we passed the Reproductive Health Equity Act. And what that measure did was ensure that Oregonians, regardless of any changes at the federal level, have access to reproductive health care. And that is everything from contraceptive care, sexually transmitted disease care, management of painful periods, well, not quite infertility. We didn't quite get
Yeah.
to the infertility, but, and gender affirming care, which might be hormones or gender affirming surgery, but typically it's more often less intensive things than surgical things. And this is the thing about that bill, and abortion. And that bill, it's an insurance bill. It talks about what is it that's covered. It didn't change any law. It just said you can't cover that differently than you cover anything else. Everything, any medical care that anyone gets, just like if you have appendicitis, you're going to go to your physician. Your physician is going to assess you. You're going to talk to your physician about the risks, and you're going to decide whether or not to have that medical treatment and whether that is appropriate for you. And I think that is the best way for these decisions to be made, is between people and their physicians. I know that there is a lot of controversy and a lot of language out there. I just fundamentally do not believe that it is true that children are going to school and secretly having gender surgeries. I mean, it doesn't make sense, because if you've raised a child and the child had a change to their body, a major surgery, and they came home from school, you would notice that. I don't know. I was asked a question earlier, are there gender affirming surgeries that parents know about that are happening in Corvallis? I don't know the answer to that question, but I do know that the statewide data shows that there is very little surgical intervention for people under the age of 18 in the state of Oregon. When I was early in the legislature, on this issue, it was a very profoundly impactful meeting. I can still picture the person that came to talk to me. And this was probably 2007, 8, 9. So way early in this conversation, where lots of folks are still kind of learning. And this was a person that was assigned male at birth, and just really had a very, very difficult time in life. It impacted every single part of their lives, and their mental health, their physical health. And they talked about just the self-hatred, the self-harming that came to try to get away from the body that they felt that they didn't fit in. And just the suffering that this person conveyed to me was just overwhelming. And that made me very committed to making sure that when people have a need, that they can have it be met. I guess I would close with, what my perspective is on that. I think these are very private decisions, and I want to respect people to make the choices they want. I'm very proud to be the parent of a trans adult. I'm just so proud of them for finding their way, and the happiness that they have now in their lives. And I don't do it perfectly yet. I probably never will, but I'm trying. And when this came up, talking with my grandmother, I really loved my grandparents. A couple of years ago, we were kind of sitting in this room, and not in this room, but in my grandmother's living room, and kind of talking about pronouns was what we first started talking about. And then we started talking about trans things. And my grandmother said, I just don't understand what the big deal is. Like, if you want to be called Bob instead of Robert, I'm going to call you Bob. Like, why can't we just let people be who they are? And she's like, it's really that simple. And I just kind of looked at her. I was like, wow, thank you, grandmother in your 80s. That was pretty profound. And then she went on to explain how totally wrong it is that my uncle has a beard, because it hides his ugly face and he needs to make better choices. So, but it was to me, I think it's that Midwestern value of, I want to love you and respect you, who you are and what you say, and trust you to make the right decision.
I was not in the legislature when that bill was passed, although I would have very proudly voted for it, because as the senator said, these are decisions that should be made between a person and their doctor, and the impact on people's lives when they're given the ability to live as who they truly are is just really profound. I was in the school district when this was all happening, and you asked about how this affects our schools. It doesn't affect our schools. This is a healthcare issue, and our schools are allowing people to be who they are, but we're not making healthcare decisions for them. So, don't have any concerns there.
Some discussion and kind of nationally of the idea of children being removed from their parents, either because they took them for gender affirming care or because they denied them gender affirming care. And I've heard that both directions. I'm not aware of that occurring in Oregon. That is not something that is written within our child abuse definitions, unless you were at the point of causing severe emotional injury, which I think would be much more than not taking someone to something, and much more along the lines of just really verbally abusing and demeaning that child, which is a very different thing than either taking or not taking a child for something that they requested.
Hi, thank you for being here. I've never been to one of these before. My name is Nancy Haldeman, and I've written to Sarah several times on the issue she just discussed. I'd like to add that bill already had that children at the age of 15 can decide that they want gender affirming care, even though their parents don't approve. And that really worries me, because kids' brains don't develop until they're in their 20s. And and there's a lot of social contagion that's happening across the country in these gender affirming care situations. And gender affirming care, just what that means is for girls to have their breasts removed, taking cross-sex hormones that have very bad effects on the body. Yes, my question. So let's see here. What my understanding is that Biden passed on his first day an executive order approving gender ideology laws across the country, and that went into effect for the last 4 years. My understanding now is that Trump has overturned all of those, and he's now written an executive orders for sex-based rights for women, for protecting minors, and also protecting women's sports. So I'd like to know how this affects Oregon. I have no idea.
I just want to start by saying that as a woman, I find it really offensive that discriminating against and denying healthcare to people is used, that protecting women is used as an excuse for doing that. Because I do not feel protected when other people are discriminated against. If you want to protect women, provide them with the healthcare they need, provide them with childcare they need, give access to education, family wage jobs, access to housing. Discriminating against somebody else and telling us that that's to protect me is just false.
Because red means on.
Yeah.
Right. Okay. Red means on. So I strongly agree that we have to protect everyone and respect the rights of everyone. And I have, again, as I've mentioned, I've had the opportunity to watch and learn about these issues over time, and just some of the experiences that my child has had, even including having to leave a workplace because of the harassment and the discrimination that was so overt, just related to who they are, was stunning. And I think when I think about what I know about youth, is that trans youth and questioning youth are among those that are the most likely to think about or to carry out suicide. And so the messages that we give to them are incredibly important. And I know that this is just a really complicated issue for a lot of folks that are sorting through it, and that no, I'm not suggesting anybody wants any youth to harm themselves. I don't think there's anybody that is in this room anyway advocating harm. I think the issue about youth being able to make decisions about their health care is not specific to either abortion or to gender affirming care. Gender affirming care, and that was kind of part of this question came up, and it was a very memorable moment within the Ways and Means Committee because the Legislative Council, the nonpartisan attorney that's not allowed to have opinions about anything except for what do the words on the paper mean, her answer, she looked at us and said, "It's an insurance bill. It's a bill about insurance." And what pre-existed was this idea that young people have the right to consent to care without the knowledge of their parents for mental health care and reproductive care. And there is not an earlier age on that for a variety of reasons. I mean, one, if you have a youth that has mental health issues, if they're having depression, if they're having suicidality, and maybe they're in a family that does not trust healthcare professionals and they really need to talk to someone, we don't want to have a law that says you can't get that help because you're 10 and you have to be 11, or you're 15 and you need to be 16. So that's, you can always seek mental health care. You can always seek substance use care. But if the law also says anything that requires you to go into the hospital, that requires you to be hospitalized or admitted, there has to be some communication with the family. There's some exceptions in the mental health care around making sure that that is safe. As it relates to abortion and reproductive health care, where this falls into, it's kind of the same thing. I mean, if we have a youth that has been sexually assaulted, if they are a victim of incest, we want them to be able to go and get that care, to get STD testing. Maybe they are pregnant and they want to go get prenatal care. We don't want there to be a barrier that is there. Again, if they're hospitalized, their parents have to be engaged and involved at a certain point. And it's the same kind of thing really as when people talk about abortion in Oregon, they talk about how Oregon is not a state that has a limit on how late into a pregnancy you can have an abortion. The reason for that is it's very, very difficult to know what are the medical conditions that might hit someone and where are you on one day or another. That what you look at in terms of the law is only the first part. If you are a person who is pregnant and your due date is next week, you cannot just walk into an abortion clinic in the state of Oregon and get an abortion. Nobody's going to do that for you. It's just, you would be hard pressed to find an abortion in this state, which is the most liberal state, among the most liberal states with abortion access, anytime after about 20 weeks. And so it's just not, you can look at the statistics in Oregon for the number of kids, and we did this around this bill. We were able to see how many 10-year-olds were pregnant, how many 10-year-olds had an abortion. And when I'm looking at a 10-year-old having an abortion, the abortion is kind of the last thing that I'm concerned about in that process. There's a lot that's led up to it. And it's a very, very, very small number. So I just wanted to put that out there because it's all of this all kind of bundles together. And as it relates to your question in that bill, it didn't newly give that. It just fit in to that idea of children being able to consent. Last thing to make very clear, one of the things that the Department of Justice has clarified for us recently is the right to consent is not the same as the right to decline. And so a child that's having a significant mental health crisis under the age of 18, the parents still do have the capacity, according to this opinion from the Department of Justice, to go and take their child to seek mental health care. The state does not have that because the government can't make you do something, but it is that difference between the seeking and the declining.
Thank you.
So the executive order, I honestly, I know that happened. I know it happened because I talked to a number of people who felt erased by that they suddenly didn't exist anymore. I don't know what power the executive order has, because at the end of the day, what it was talking about, like many of these executive orders, are how do we interact with each other? So before the president signed that executive order, I meet someone, I ask their name, I ask their pronouns, I refer to them that way. I do that at work. I do it every place. After the executive order, I did the same thing. So because there's not a place where there is no place where a child or a youth goes into a school or a child care or a healthcare clinic and someone says to them, you know what, you need to change your pronouns or you need to have this medical procedure. It just doesn't happen. What those conversations are about is really what my grandmother said. If you say to me, you want to be called Nan instead of Nancy, I'm going to call you Nan, period. But it's not that you come to me and I say, you know what, I really prefer to call you Nan, or you look more like a Nan, so I'm going to call you Nan instead of Nancy. That really is what that is.
I think people have questions too.
I think. Yeah. No. So we're going to move on to the next question here.
I don't serve at the federal level, so I can't answer. I can't answer I don't have the information, and I don't want to give you a wrong answer. And I do know there's other folks that have questions too. But I'm glad. Write to me, and I'll write back, and I'll try to find that information for you.
We're wrapping up in less than 15 minutes here. We do have a couple of additional questions. So, and if anybody, I see somebody raising your hand, if you have another question, please do come up. I'm going to go to a written question here and change topics completely. Does it make sense to remove development fees for all new development, not just affordable or low-income housing? Do you have thoughts on that?
I think that's something that I would have to investigate more before I had a firm yes or no answer on it. My, off the top of my head, but totally changeable opinion would be no. But, again, if you want to know more, email me and I will investigate more and give you a more reasoned, thoughtful opinion.
I also have a nuanced answer because that isn't in front of me, and like what the sideboards would be, like where, for how long, for what purpose. I do think that our housing crisis is a really challenging question because it's like everything. There's not a one size fits all solution. Look at middle housing. I like the idea of middle housing. It makes a lot of sense to me in our urban areas, in our suburban areas where we can have infill, where we can have ADUs, where we can kind of build things in. That makes a ton of sense to me. I don't know that that's necessarily the strategy in more rural areas where there is more space to build out, or maybe the infrastructure is not there to support it. And that is kind of the challenge that we often have. Lawmaking is kind of a really blunt instrument. It does become kind of one size fits all. So no matter what you do, you're going to find the example of, well, that didn't really make sense. Why did you support that thing? As it comes to development fees, and I heard somebody say the other day, it's a housing crisis. We should just take 5 years, take all of the regulations and fees off the table and have everybody build like crazy. And let's just get the housing up. Well, no, but no, and there might be targeted places in which that is important. Can we look at, are there areas where we need to kind of rapidly speed things up? And we do that, how do we address the infrastructure needs that are there? We can't build housing without the infrastructure to go with it. And that's what those fees generally are for. I will be honest, I don't know how I will vote on the governor's land use bill that's coming forward. I have come to the place where I am willing to be pushed on things that, around modest changes to land use laws, modest. I didn't vote on the first round of it. I voted on the second round because we pulled in the kind of changes into the urban growth reserves and upped the affordable housing pieces. But as it currently stands, the proposal, I don't think takes into consideration parts of the state like we're we live. And so the bill, as I understand it right now, would remove notices to people. It would make it difficult for people to find out information about whether the infrastructure was adequate. And I always think more transparency is better than less. But more importantly, it would prohibit doing things like a traffic study or an infrastructure assessment. And I mean, in our area, if you look at the place where I'm hearing about this most in our community, it would be in North Albany. And the traffic issues there, I mean, we all drive on that road. It's dangerous because that road was never built to hold the capacity that it has. And we put in, 80 additional units or 200 additional units. It is going to have an impact there. And we can't pretend that it doesn't. And that doesn't mean we shouldn't find ways to build more things or smaller footprints. That's not what it is. It's just, it has to be this both and. There's other things I really like when it does talk about the infrastructure, we had the issue in Corvallis with the Boys and Girls Club, and you have the single pipe or the two pipes. Okay, let's just have this, that worked for the single pipe. Let's get rid of the things that don't make sense, but it just can't be a blunt instrument. So if there was a neighborhood, an area, a place where we had builders ready to go and we knew what that was and we knew that it was going to help us address that crisis and get people into housing that don't have it, and there was adequate infrastructure to make everything happen, yeah, maybe, but not everywhere and not forever.
Thank you. Looks like we have an in-person.
Right. I'm Tom. I want to thank the two Sarahs. I don't usually speak to more than one person at a time. So first off, if anybody wants to know about pharmacy benefit managers, see me after this. I promise I'll have a question. And then the second thing I wanted to do was thank you both for wrestling with these topics, very difficult ones. And getting to higher ed and landfills. And in terms of higher ed, my wife was hired by OSU 30 years ago. And she did a lot of the groundbreaking work on forever chemicals. And since then, her graduate students have gone out all over the world. And you're absolutely right that you can't just cut the funding and expect that to start up again. So keep up that good fight. And because she's thinking about mothballing right now. We have one executive order after another. And what can we do to support higher ed in these difficult times?
That's a really hard thing at the local level. I think just supporting the mental health of your wife who's having to deal with this craziness, because I think in our community, there are going to be a lot of people, or there already are a lot of people who are under a lot of stress and feeling the uncertainty of what, 30-year careers are how they're going to end because of this. And so supporting the individuals in higher ed is really key. But as far as all those grants go, we in the legislature we can't make decisions about those federal grants. We can try to fill holes, but as we know, our budget is going to be really limited. And so this is going to be a really downer answer. So I think, continuing to let our federal delegation know how important it is and how it's going to affect our community. The Democrats that we have representing us on the federal level get this. Do not shy away from also contacting Representative Benz. He represents Oregonians. In the current situation, he's the person from Oregon who has potentially the most influence on the federal level. And I think that's where we are for those big scientific grants, because we're seeing like 55% cuts from NSF and things like that. And that's just terrifying for a community like ours, where one of our major employers is higher ed, and the other agencies that are around related that are partnering with OSU. And I am on higher ed. I'm advocating for higher ed as much as I can, but I think we just need to keep letting people know it's a priority. But I think we also need to be realistic about what it's going to be hard. And I'm sorry, I don't have better things to say.
Agree with everything Representative Finger McDonald said. One of the things that I've been wrestling with is that whenever there's chaos and crisis and uncertainty, we look at the thing that's right in front of us. And the thing that is most tangible to touch about all of this is the money, or the lack of money, where the funding comes from. But I'm starting to think more about what's the there behind all of that, and what do we need to guard against and think about. So, one of the ideas that I've heard is we need to, really support our universities to step up their fundraising and the investments from private organizations and corporations that will kind of support the mission of the schools. Well, that also becomes problematic, because once you are also having to serve your donors to keep things operating, you start to lose that sense of academic independence. And I think that's something that we value in democracy and in the United States. We value coming to town hall meetings where we can have really different opinions about things. And sometimes our opinions are going to make each other really mad, but we live in a country where that's what we do. We come and we talk about things, we try to understand each other. What we do in our institutions of higher learning is people ask questions that excite us, questions that are curious, questions that offend us. And then we get data. And that data helps us build stronger communities. It helps us live longer. It helps us learn better. It helps us enjoy the world in a better way through literature and art and music. As that gets chipped away, the independence of that, or the idea of thinking, that is what is really starting to worry me. If we look at the executive orders, and I, just said, well, what difference does the executive order make? Because I did this the day before and the day after. Some of them do make and they're painful to whoever it is that's being targeted on that day, but it's also the why. So one of the rules that was signed, executive orders the other week, rescinded the rule that prohibited banks and credit card companies from requiring women to have their husbands or a man or a father be a cosigner on their bank account or their credit card, or to get a loan or to get a mortgage. Now, are the banks going to do that tomorrow? No, they need our money. But why? What's the purpose of that? And then if you just start looking around, what are the images that you're starting to see, that we're all becoming used to? What are the changes in the people around you? What are the things that people are becoming more comfortable saying that nobody would have imagined somebody saying in a public place a while ago, especially as it relates to race and women, disabled people? That's really what worries me, is what is underneath this place. And the other thing about universities are young people who are challenging authority. They're challenging the way things are. They're pushing back. They're places where we build our diversity. We're seeing our students just get sent back who've not done anything back to, if there's students who are here on a visa. So I think we need to look at the money. And I think we need to pay very close attention to what is underneath if we look at democracy. And I want to make sure that whatever we're doing, whatever the funding is, the presidential administrations come and go, and we like some, we don't like some, but always before we get to the other side and we still have a democracy. I want to make sure we get to the other side and we still have forums where we can come here and talk and disagree, and you can leave really angry at me, or I can leave really angry at you, and we'll all come back next month and nobody gets arrested. To me, that's who we are, and we need our universities to be that same place.
Well, I promised that we would get out by 11:45. I have one quick, maybe like follow-up question to the Osborne, because we have some Osborne folks in the crowd here. Is the $4 million of lottery funds dependent upon the $1 million of private funds? And could the amount requested be 5 million without the private funds? Just maybe a quick education on that part.
And Representative Finger McDonald is on this too. She's championing the Adair Village, is like the lead on that because they need sewer and like,
And it's 800 to the 1,000 houses if we can get that built.
yeah, it's a really big deal. And neither of them have bill numbers. They're in the lottery fund. We already got asked that question, didn't we? No, like the request is already in. So the idea is it's $4 million just straight out with the addition, with 1 million is the matching. So it would be 4 million no matter what. It's always helpful. I was advised when I talk to the folks that sit on those committees and do them, that asks are much more successful when you can show community or other participation. Because what you're looking at is asking the whole state to come and help with a local thing. So you want to see what is that local piece. And that's also why we also will be really emphasizing in this process, this is not a deferred maintenance issue. This was an unforeseeable emergency. We actually have a letter from the assessors talking about just what an exemplary job the city and the school district have done with upkeep and maintenance of an operation of the facility. And so that is why. I wish that we could ask for more. And I'm glad it's lottery funds, which gives a chance. But I've told my colleagues, like, my community really likes this. I really need you to help me get this because I don't know if I can go home if we don't get this done. So please know if we don't get it, I will have tried my best. But I'm going to make sure we get it, maybe.
Yeah, I mean, I don't have anything to add to that. I think we're building this amazing coalition of supporters for that. I'm a mom who took my kids to Osborne a lot. I live near Osborne, and now at least they've got the outdoor pools open, so I see the activity there, but it was so sad when it was just fenced off and nobody was there, because I know that there are so many people in our community who use that facility. And I also know it's an economic driver because people across the state come and they spend their money in our community when they come swim here. So, yeah. Make sure they know it's important.
We're getting a letter of support from a physician at Oregon Health Sciences University that is the statewide drowning prevention coordinator. I mean, it's just like these people
Because how many kids have kids who learned how to swim at Osborne?
Yeah, as we drove by, my 8-year-old in the back seat is like, Mom, this week it's open outside, as we went down. So I'm like, I know, but yes. Well, thank you so much. Thank you, Representative Finger McDonald and Senator Gelser-Bluen. Thank you so much for your time, sharing your perspective. And thank you all that attended. And for those that may be viewing this afterwards online, thank you for your curiosity, your advocacy, your questions. And a quick reminder that we have a couple of things coming up, including June 7th, the next and last time for this legislative session that we would be here and hearing from our elected officials. And then we also have, okay. And then just, I think we all know that we have an election coming up, but just as a reminder, and May 20th election, and you should have your ballots probably in your mailbox right now and your voter pamphlet. And there is, wanted to mention that this week we did both a candidate fair as well as a candidate forum. And the candidate forum was for the one contested race for the Corvallis School Board, position 1, that is now on the league's YouTube channel. So a couple hundred people have already jumped in to watch that in the last day or so. And so please get informed and listen in and as you make your choices in this election. So I want to say thank you all so much and enjoy your Saturday. Right.